1st of April 2023, the NHS Black Country Integrated Care Board took on responsibility for the planning and buying for local pharmacy, optometry and dental care services from NHS England. We have around 288 pharmacies, 121 optometrists and 159 general dental practices. We welcome these services, and by working more closely with them, it will allow us to make sure they are offering the right service for the people we serve. In this month's Feet on the Street, we hear from local people on their recent experiences of using these services.
And for years I've used the same opticians that do my eye test and the diabetic eye screening. I phoned up to make an appointment. We don't do that anymore. No opticians do it anymore. So I googled it and I found I've got to travel miles. Why? I mean, even if I went to a local hospital to have it done. New Cross has got an eye department now. Why haven't they got one there?
My name's Janet. Went to the Opticians recently. They said everything was brilliant and they was all friendly and they was good.
I haven't accessed Opticians for well over maybe a decade now, because it's about being able to get there and about problems with being autistic and having executive function issues, being able to arrange that stuff, and basically the more effort it takes, the less likely I am to do it.
So I was offered or provided with an appointment at 9 o'clock in the morning and instructed that I was not permitted to drive for 6 hours after the test because of the eye drops. Fortunately, it's no problem for me because my wife was able to drive me in. There should have been an appointment, in my view, at 11 o'clock or after, so that I could have gone on the bus. And then the other thing is I was told I would get the result within 3 weeks. My appointment was early October. I eventually rang the agency that was managing the system in early January because I hadn't had the report. And it was dated a week after my appointment with the optician. Fortunately, I got no problem, but if I'd had problems which needed attention, then that really would have been far too long. No problem at all with the opticians, they were perfect, but it's just the management of the system was dreadful.
I found there's a lot of lack of communication with the way pharmacies work. So at the moment there's like an ADHD medication shortage, and instead of being told this, I had to go in, find out, and then they're told, wait 14 days, and then there's no communication between those 14 days. They don't contact you or anything about what's going on with the situation. And then in order to get it, they tell you that, we can't contact you under the pharmacy, you're going to have to go and do it yourself. In order to get alternative, you need to call 20 different places to just try and get one alternative to a medication. And it just creates more havoc instead of the pharmacy just communicating with yourself and then other pharmacies around the area and just phoning up and saying, have you got this? Can you order this? Or is it just us?
I had a really bad water infection, which I don't really get very often, but I did. And I phoned my GP surgery at 8 o'clock, I think they said, and I couldn't get an appointment. I did that for about 3 days, but my symptoms only worsened. So I then phoned my pharmacy that I use, and she said, unfortunately, the antibiotics that you need have to be prescribed. But then she made me aware of a service that I actually never heard of. They will sit down with you, they will talk to you about your symptoms, and they may be able to prescribe you something. I phoned in a supermarket pharmacy, which she told me about, and they said, yes, come in straight away. And I was like, really? Wow, this is amazing. So I went in and I was seen within 30 minutes and I was prescribed a 3-day antibiotics.
One particular pharmacy where I had the pre-prescription being dispensed at, and I was finding that repeatedly it wasn't ready when I was going to collect it. And the prescription was being ordered online, and I was going well after the time it was supposed to be ready for, and I was finding that I was having to wait up to half an hour when I got there to receive the prescription.
Dentists have stopped performing a scale and polish at the end, which I think is a real shame, because I feel you go in to get your teeth checked, make sure that your oral health's fine, but can go away with staining on your teeth. And I think for people who go along to a dentist, it can be quite a stressful experience anyway. I'm quite happy, I don't really have any nerves about that. You go in and it'd just be nice to come out with that dazzling smile and just have some of that taken away. So you've got a healthy mouth, but it's actually looking better than it could do. So I appreciate that that's something that you can pay for now with a hygienist, but I feel like it's just finishing a job properly.
I've never had any difficulty accessing a dental appointment. Very responsive as a dental practice. The staff are very kind and caring, and even the follow-up appointments are very timely within the plan that's obviously outlined to you. What I also find as well is you will get a reminder, a text reminder service outlining. In fact, that comes the minute you leave the dental practice. You've got it there reminding you when the date is of your next appointment, and then you'll get a reminder. Usually it's a phone call as well as a text a few days before.
Back in October, my husband knocked my tooth out by accident. He rolled over in bed and elbowed me, and my crown fell out. I have now been back to the dentist, obviously, and I've got to go to the dental hospital to have quite a few teeth out because I hadn't been able to afford to go.
They don't notify you if you missed an appointment, and they should write to you, because how are you supposed to know? I do so much in the community. I know some people might have family, children, and it might slip their mind. I've looked for an NHS dentist, can't find one. Then I think I went to somewhere in Bilston, I think it was, you know, like where they could see you as a one-off or whatever it is. They wanted to pull up, they gave me some antibiotics. And they said, oh, we can make you a dentist. I said, I don't want to take my teeth out. He said, they're by the nerve. And I was like, I should have asked for a second opinion. I was too scared to say anything.
ਤੁਹਾਨੂੰ ਆਪਣੇ ਡੈਂਟਿਸਟ ਦੇ ਨਾਲ ਕਿੰਨਾ ਸਰਵਿਸ ਹੈ ਥੋੜੀ ਚੰਗੀ ਆ ਜਾਂ ਠੀਕ ਮਾੜੀ?
ਠੀਕ ਆ ਸਾਰੇ ਹੈ ਉਹ ਵੀ ਠੀਕ ਹੈ ਸਾਰੇ।
ਆਪਟੀਸ਼ਨ ਅੱਖਾਂ ਵਾਲੇ ਕਿਦਾਂ?
ਉਹ ਵੀ ਠੀਕ ਹੈ ਅਭੀ ਜੀ ਚੈੱਕ ਕਰ ਦਿੰਦੇ ਆ।
ਕੋਈ ਕੰਪਲੇਂਟ
ਨਹੀਂ ਨਹੀਂ ਕੋਈ ਗੱਲ ਨਹੀਂ।
ਤੇ ਫਾਰਮੇਸੀ ਕੈਮਿਸਟ ਦੇ ਨਾਲ
ਉਹ ਵੀ ਠੀਕ ਹੈ ਸਾਰੇ।
ਤੁਸੀਂ ਦਵਾਈ ਉੱਥੋਂ ਲੈਣੇ ਆ ਕੋਈ
ਪ੍ਰੋਬਲਮ? ਸਾਨੂੰ ਜਿਹੜੀ ਡਾਕਟਰ ਨੇ ਸਾਨੂੰ ਦਿੱਤੀ ਦਵਾਈ ਅਸੀਂ ਉਹ ਲੈ ਲੈਂਦੇ ਆ ਉਹ ਸਹੀ ਖਾਈ ਜਾਂਦੇ ਉਹ ਸਾਨੂੰ ਕੋਈ ਪ੍ਰੋਬਲਮ ਨਹੀਂ ਪੈਂਦਾ ਹੈਗਾ।
As we build our relationship with the contractors who run these local services, we wanted to hear their views on the challenges they face and the opportunities that we now have to work more closely together.
What are the opportunities for optical practices? We can provide many services if they're commissioned to help reduce the pressure in hospital eye services, such as glaucoma monitoring schemes. The challenges that we face are IT infrastructure, so we need to be able to effectively send information to the hospital, to GPs, and be able to receive this as well. So in order to have commission services, we need good IT structure. We can also help to reduce health inequalities by providing blood pressure checks, alcohol screening, weight management, and smoking cessation, because we're working in the heart of the community as well. Optical practices are looking forward to working with the board in the future.
Pharmacy has consistently delivered access to prescriptions, services and advice throughout the COVID pandemic and since restrictions have been lifted. Our doors have never closed. We're very much looking forward to working with you. With the devolution of some NHS Midlands team responsibilities down to ICB level, it means that the managing of information and the uptake of national and local services can be tailored for local needs. Our biggest challenge is workforce and capacity within pharmacy. There are many issues: recruitment, retention, training and upskilling. But with pharmacy's willingness and a can-do attitude, I'm sure there is a great future of collaboration and cooperation between us for the benefit of all that work and live in the Black Country.
As a local dentist and speaking to others from the Black Country, the key challenges we face include the recruitment and retention of staff, arranging timely translation services for patients whose first language is not English, and our high rate of appointments where a patient failed to attend. We'd like to improve access to our services and hope by working more closely with the ICB we can find solutions to this and the challenges we face. We also hope to seek the opportunity to explore a Black Country dental hospital for the local population.